Our thyroid gland is a tiny powerhouse. It's located in our necks, shaped like a butterfly. This gland might be small, but it plays a big role. It produces hormones that regulate our metabolism. These hormones impact our energy levels, heart rate, and even how our brains work. When our thyroid is working correctly, it's like a beautiful symphony. Everything is in sync, working together harmoniously. But sometimes this harmony can be disrupted. One such disruption is a condition known as Graves' disease. Graves' disease is an autoimmune disorder. This means that the body's immune system, which normally protects us from harmful invaders, mistakenly attacks the thyroid gland. This attack causes the thyroid to go into overdrive, producing too much thyroid hormone. This overproduction leads to a condition called hyperthyroidism. While Graves' disease primarily affects the thyroid, its impact can be felt throughout the entire body. Understanding this complex condition is the first step toward effectively managing it and living a full and healthy life.
Imagine your immune system as a dedicated security team. Its job is to identify and neutralize threats to your body, like viruses and bacteria. But in autoimmune diseases like Graves' disease, the security team gets its signals crossed. It begins to mistake your own body's cells for dangerous invaders. In Graves' disease, the immune system specifically targets the thyroid gland. It produces antibodies that bind to the thyroid cells, mimicking the signals that normally tell the thyroid to produce hormones. The thyroid, flooded with these false signals, goes into overdrive, producing more thyroid hormone than the body needs. This overproduction of thyroid hormone, known as hyperthyroidism, is the hallmark of Graves' disease. It's like pressing the gas pedal on your metabolism, causing a cascade of changes throughout your body. Your heart races, your hands tremble, and you feel constantly energized even when you haven't slept. Graves' disease is more than just hyperthyroidism. It's a complex condition with a wide range of potential symptoms and complications. Understanding these nuances is essential for effective management and treatment. The exact causes of Graves' disease remain somewhat of a mystery. Scientists believe that a combination of genetic predisposition and environmental triggers plays a role. It's like a puzzle with multiple pieces, each contributing to the overall picture. Genetics undoubtedly play a role in Graves' disease. If you have a family history of the condition, you're at a higher risk of developing it yourself. However, having the genes doesn't guarantee you'll develop Graves. Many people with a genetic predisposition never experience symptoms. This is where environmental triggers come into play. Stress, viral or bacterial infections, and even certain medications have been linked to the onset of Graves' disease. It's like a switch that flips, turning on the genes that trigger the immune system's attack on the thyroid. While we haven't pinpointed all the triggers for Graves' disease, understanding the interplay between genetics and environment is crucial for developing effective prevention and treatment strategies.
Graves' disease can manifest in a myriad of ways, making it a bit of a chameleon in the medical world. Some people experience a sudden onset of severe symptoms, while others have a gradual progression over time. Recognizing the signs is crucial for early diagnosis and treatment. One of the most common symptoms is a rapid heartbeat, often described as a racing or pounding sensation in the chest. This occurs because the excess thyroid hormone stimulates the heart to work harder. You might also experience hand tremors, anxiety, and difficulty sleeping. Other symptoms include weight loss despite increased appetite, heat intolerance, and changes in bowel habits. Some people with Graves' disease also experience eye problems, such as bulging eyes, double vision, or eye irritation. This condition, known as Graves' ophthalmopathy, occurs when the immune system attacks the tissues surrounding the eyes. Untreated Graves' disease can lead to serious complications, including heart problems, osteoporosis, and thyroid storm, a life-threatening condition characterized by a rapid and severe increase in thyroid hormone levels. Early detection and treatment are paramount for preventing these complications.
Management and treatment options, navigating your path. Managing Graves' disease is a journey, and the path is rarely linear. It often involves a combination of treatments and lifestyle modifications tailored to each individual's needs and preferences. The goal is to control the overactive thyroid and alleviate symptoms, allowing you to live a full and healthy life. Medications are typically the first line of defense. Antithyroid drugs work by blocking the thyroid's ability to produce hormones, effectively slowing down the overactive gland. Beta blockers can help manage symptoms like rapid heartbeat and tremors. Radioactive iodine therapy is another treatment option. It involves taking a small dose of radioactive iodine, which is absorbed by the thyroid gland. The radiation destroys some of the thyroid cells, reducing the gland's ability to produce hormones. In some cases, surgery to remove all or part of the thyroid gland might be recommended. This option is typically reserved for individuals who don't respond well to medications or radioactive iodine therapy, or who have complications like a very large goiter. Lifestyle modifications can also play a significant role in managing Graves' disease. Eating a balanced diet, getting regular exercise, and managing stress can all contribute to overall well-being. Eye complications and ophthalmic care, protecting your vision. Graves' disease can sometimes affect the eyes, leading to a condition known as Graves' ophthalmopathy, also known as thyroid eye disease. This occurs when the immune system mistakenly attacks the muscles and tissues surrounding the eyes, causing inflammation and swelling. The most common symptom of Graves' ophthalmopathy is bulging eyes, which can make the eyes appear larger or more prominent. This occurs because the inflamed tissues behind the eyes push the eyeballs forward. Other symptoms include double vision, dry eyes, light sensitivity, and eye irritation. Treatment for Graves' ophthalmopathy focuses on relieving symptoms and preventing further damage to the eyes. Lubricating eye drops can help with dryness and irritation. Corticosteroids, either in oral or intravenous form, can reduce inflammation. In some cases, surgery might be necessary to improve eye alignment, reduce pressure on the optic nerve, or improve the appearance of the eyes. Orbital decompression surgery involves removing some of the bone and fat behind the eyes to create more space and reduce pressure. If you experience any changes in your vision, such as double vision or blurred vision, it's crucial to seek immediate medical attention. Early diagnosis and treatment of Graves' ophthalmopathy can help preserve your vision and prevent long-term complications.
Pregnancy and emotional well-being. A journey within a journey. Navigating Graves' disease during pregnancy presents unique challenges, requiring careful monitoring and management by both the mother and her healthcare provider. The fluctuating hormone levels during pregnancy can affect the course of Graves' disease, making close observation essential. Antithyroid medications are typically the preferred treatment option during pregnancy, as they effectively control thyroid hormone levels with minimal risk to the developing baby. However, the type and dosage of medication might need to be adjusted throughout the pregnancy to ensure both maternal and fetal well-being. Graves' disease can also take an emotional toll, both during pregnancy and beyond. The unpredictable nature of the condition, coupled with the physical and hormonal changes of pregnancy, can lead to anxiety, mood swings, and even depression. It's essential for women with Graves' disease to prioritize their emotional well-being. This might involve seeking support from loved ones, joining support groups, or talking to a therapist. Remember, you're not alone in this journey. Finding support and community. You are not alone. Living with a chronic condition like Graves' disease can feel isolating at times. It's important to remember that you're not alone. Millions of people worldwide are living with this condition, and countless others have loved ones who are affected. Connecting with others who understand your journey can be incredibly empowering. Support groups, both online and in person, offer a safe and supportive space to share your experiences, ask questions, and learn from others who have walked a similar path. Don't hesitate to reach out to your healthcare team for guidance and support. They can connect you with resources in your community, provide education about your condition, and address any concerns you might have. Remember, you are your own best advocate. Educate yourself about Graves' disease, ask questions, and don't be afraid to speak up for your needs. Conclusion: embracing your strength. Graves' disease is a journey, not a destination. It's a journey that may have its ups and downs, its twists and turns, but it's a journey that you can navigate with knowledge, resilience, and a strong support system by your side. Remember that you are stronger than you think. you are capable of living a full and meaningful life, even with Graves' disease. Embrace the challenges, celebrate the victories, and never stop advocating for your health and well-being.